Nutrition is an essential component in medical aesthetic treatments. It is not only about external aesthetics, skin quality, cellular repair, and metabolic response are directly influenced by the patient's diet. A balanced diet must fulfill three key functions: provide energy, facilitate tissue regeneration, and regulate metabolic processes. In this context, hypocaloric, ketogenic, and protein-based diets have specific clinical applications. The hypocaloric diet aims to reduce energy intake without compromising essential nutrients. Its design must be adapted to the patient's basal metabolism, considering variables such as age, sex, and physical activity. The ketogenic diet, by restricting carbohydrates, promotes the use of lipids as the main energy source, inducing controlled ketosis. The protein-based diet represents an effective strategy in weight loss protocols. It begins with a strict ketogenic phase with high-quality protein intake, followed by a gradual reintroduction of foods. Medical supervision is essential to avoid complications. On the other hand, intermittent fasting has shown beneficial effects at the cellular level. It improves insulin sensitivity, activates autophagy, and reduces inflammation. However, its implementation must be individualized. Integrating these nutritional strategies allows optimizing clinical and aesthetic results, approaching the patient from a global and interdisciplinary perspective.